So instead of buying this product from other places or other people, if I want the product myself, then I have to join the MLM. So for me, it's very different. In most other MLMs, you join because you want to make a profit, you want to sell, you want to earn money. But when with the AFC, you can join because you want to get healthy, because you want to maintain your health. So it's very different from the other MLMs outside. I tell you a bit about my story. Most of the time, when you attend an MLM, when someone invites you out, say, hey, let me share something special, something new product with you. So most of the time, they are the ones telling you the product. They are the ones trying to give you all the information and try to get you interested. For me, it's the other way around. I joined under Grace, one of the Coreda now. Yeah. So my meeting with her was very different. When we met for the first time on Zoom, and after the introduction, then she said, okay, so let me start to tell you about the product. I say, you wait, you hold first, you let me tell you about the product. And then you tell me whether I'm correct or wrong. Because if I'm correct, the next thing I want to know is, how can I buy this product? But if I'm wrong, that's the end of it. I'm not going to see you again. So for the next 10 minutes, I am the one telling her everything I know about this product. And at the end of it, she said, this is exactly what she told me. Dr. Aaron, I got nothing to say already. You say everything already. Yeah, so why it become like this? Because this product is very different. This product is something that I was looking for it. I was looking for it. I was researching into it. I was studying into it. And then I found it. And so this is why this product is very special to me.
Have you heard Dr. Ma's story?
Dr. Matt.
Dr.
Not
Ma,
sure.
Kevin Ma.
No.
It's pretty similar, you know. Dr. Ma
Similar.
also study about our product. Then he got interested with it.
So that's the special thing about tonight's product, which I will try to share with all of you here, because this product is not something that you have to convince the doctor that it is good. But in reality, this is something that medically proves that it is good. And so doctors actually, those who are interested in health and regeneration and not just making money, will actually be able to find this product and very easily get advice. I will share this with you in the LOP.
Good Lord, I am recording and live streaming today. Just today, we start live streaming into our Facebook so I can save it to use it later. And it's you who started it. So, Doc, can you please start so we all can get the information? And by the way, guys, if you have a question, I think during or at the end of the presentation, Doc, you want the question.
Uh, I think it will be better at the end.
Hmm.
I think it will be good if everyone who has questions, you can just put it into the general chat. So once I have finished my presentation, Gregory has finished his presentation, we will go through the chat, we will look at the questions, and we will answer them.
Agree.
Okay, so
So,
I
Doc,
begin.
please.
Okay, is my screen visible?
Yes, yes.
Okay, so I will start. So AFC, yeah, when we talk about AFC, for me, it is talking about cell regeneration and immunotherapy. Cell regeneration. So now the thing is a little bit about me that I did not share earlier during our chat with you. So my name is Dr. Aaron. I'm working in primary care. I have been in primary care for the past 12 years. So primary care is what you know of as a clinic, general practitioner. So now the thing about clinics that a lot of people don't know is that actually our job is not to treat diseases. Our job is actually to do prevention, education, and to make sure that you remain healthy. So for example, if you are not well, you have fever, cough, cold, flu, you have high blood pressure, diabetes, cholesterol, by right, you are supposed to go to a hospital because a hospital is for treatment. But in Malaysia, everybody has gotten it wrong. They're all coming to the clinics. And in reality, if you feel you are well, if you think that you do not have any diseases, you are supposed to come and see me in primary care because it is my job to screen you, to take blood, and to make sure that you are healthy. Because if I do screening, then only I can find out early stages and early signs of disease, and I can do early preventive methods and make sure that you maintain healthy. So in the 12 years that I have been in the clinics, I have been treating so many people for so many different types of chronic diseases, acute diseases. And the thing is this, I have always come across this same question. Doctor, can I get well? So chronic diseases such as heart disease, stroke, diabetes, did you know that being obese, being fat is also actually a disease? Lung disease, smoking, Alzheimer's, diseases that once you detect stays with you for a long time and slowly degenerates your body. And the thing is, I also manage acute diseases like sudden death, infections, heart attacks, infections, and recently now is the influenza, the avian flu is back, and it's affecting a lot of Malaysians. So the thing is this, when you look at death due to acute diseases, you notice that the age is getting less and less. People used to die at 80 years old. People used to then later start dying at 60 years old. Now you have people passing away at 35 years old, 28 years old, and even this. So deaths are getting earlier and earlier. And when you get scared or when you have a disease, when you come and find me, you know what is the only thing I can do? I can only give you medication. So now the problem, let me share with you the problem that I face in medicine, okay, medicine in general. The main problem that I face is that I am only able to control your disease. So if you have high blood pressure, I give you medication. I can only control your blood pressure. I cannot help you to recover from the damage that the blood pressure has caused. For example, hardening of the vessels, kidney damage, heart damage. I cannot help you to regenerate from there. Basically, you can be controlled, but you cannot get well. If you have, for example, diabetes, I can give you insulin and I can control your blood sugar. So your blood sugar back to normal, but with medication support. I cannot help you get well. I cannot repair your pancreas. I cannot increase your insulin amount. I cannot fix the kidney damage or liver damage or even eye damage that has occurred because of all the high sugar. For example, heart attack. I can give you medication to control your blood pressure, to reduce the coagulation of your blood, to prevent another heart attack. But I cannot help you to get well. I cannot help you regenerate your damaged heart muscles. I cannot help you to regenerate your blood vessels. So that is the main problem that I face in my 12 years of trying to treat patients. And just now I said, the most common question that I get from patients is, doctor, can I get well? And unfortunately, for 12 years, up until May this year, I can only tell them, sorry, I can only control. I cannot help you get well. So tonight, I want to share with you the reason why I say now there is an answer. I can say, yes, you can get well. So when we talk about getting well, we talk about regeneration. And when we talk about regeneration, the first thing that comes to mind is stem cell therapy. Stem cells, you will understand it as the cells that are full of potential. They are able to differentiate into any type of cell in the body, which means to say that they can replace any damaged cell in your body. Problem with this, number one, it is very, very, very expensive. You have heard of stem cell therapies coming from human placenta or embryos, then later on animal placenta. There are even some research in stem cell therapy saying that they try to extract stem cells from the blood. There's even stem cells coming from plants. But all these things, very expensive. Then the problem is it works. So when it works, but it's very expensive, those who can not afford it, they have no other options. There's no way to regenerate. So for me, when I started looking into regenerative medicine, I found stem cell therapy. But stem cell therapy for me brought up another question. The way I understand it is that stem cells have to come from your own body. Meaning to say that if I take Gregory's stem cells and consume, put it into my body, and if according to what the stem cell companies are telling you, they will heal the damaged parts of the body. That means Gregory's cells are growing in my body. And if foreign cells grow in my body, I'm sure you know what that is. That is cancer. So that's very impossible. How can I expect other organisms, other animals, or other humans' stem cells to actually help me repair? But the thing is this, when I look into stem cell therapy, it works, which is the main reason why so many people are still buying, still going for this therapy. So that led me further into research. What is it about these stem cells that can actually still provide this healing, regeneration function in our bodies? And the next step led me to peptide therapy. So you will see different type of peptides, out there. Peptide therapy is very widespread. So what are peptides? Peptides are actually short protein chains. So we know protein as a type of food, meat, chicken meat, that's protein, fish meat, that's protein. So, but protein does not have any function. It's just a very long chain of amino acids. And we know amino acids are the basic blocks. So what are peptides? Peptides are actually short protein chains. Okay. Now, what makes peptides so special? Because while we know that amino acids are the building blocks, they are like nutrition. And we know that protein is food. Peptides, on the other hand, has a function. So peptides are very small because they are smaller than proteins. They are smaller than the cell membranes of bodies. And so they can actually easily pass through them. So they are very easily absorbed. They are very easily passed into the body. And because they carry out functions, they can immediately generate that specific function for you. So I give you an example of a peptide. Did you know that insulin is a peptide? Insulin. So when you inject insulin, what happens? It is immediately absorbed into the body. It travels into the cells and it performs its function, lower blood sugar. So that's it. So once it has performed its function, it disappears. And you know that it does not have any side effect. The more insulin you take, the lower your blood sugar drops. The less insulin you take, the less your blood sugar drops. Simple as that. Another example of peptide that you will know of is actually hormone. So for example, thyroid hormone. Thyroid hormone, when you consume it, it goes into your body. It only has one function, increase metabolism. So it will be absorbed very quickly. It goes to every cell of your body and it stimulates the function, activates the function, increase metabolism. So increase activity. So for patients with hyperthyroid, which is thyroid is very active, so too much thyroid hormone is being produced, you will see that they are very active, they are very alert, but the unwanted effect is that they will keep losing weight no matter how much they eat because the cells are too active already. Okay, so you see that the more hormones they are, the more the effect that you get. The less hormones they are, the less the effect you get, which is actually how peptides work. So the thing is this, if peptides are so good, how then should we take peptide therapy? So that led me to my next line of research. What kind of peptides are suitable for me? If insulin is a peptide and insulin is so good, why are we having problems with insulin in KKM? You know why? Because the insulin that we use is not human. The insulin that we use comes from cows. It's bovine insulin. Okay? Of course, the best insulin is porcine, which is for pigs, but well, in Malaysia, the next best is cows, right? And just now, the other example I use is thyroid hormones. Did you know that the thyroid hormones that we use to treat patients are synthetic, which means to say that they are lab-made, they are man-made, and they are not the real proteins that is produced by the body. So this means that these peptides actually will have some form of side effect on the body because it is not the body's own peptides, see? And it is not active or it is not natural peptides. So what kind of peptides should I look for and how to get them? So here is the very interesting part. Listen carefully here. Did you know that there is a peptide that has been studied by Japan and they have already published, they have found that consumption of this peptide will increase the growth factor level, the insulin-like growth factor 1 level. And we know that insulin-like growth factor 1 is just like a growth hormone, which means to say that it actually gives the effect or it gives the instruction to the cells to say multiply, grow, regenerate. So if I can get the whole of this peptide, that means that I can regenerate. I can force my body to regenerate. Here is another peptide, also studied by Japan, which finds that the first one is actually the one with the peptide, and the second group is the one without the peptide. After 8 weeks of consumption of this peptide, they noticed that, what is this? This is the acceleration pulse wave index increase. And this acceleration pulse wave index actually measures the amount of blood vessels that are in our body. So if this peptide can increase this acceleration pulse wave index, it means that this peptide can actually stimulate our body to grow new blood vessels. So if I can increase more blood vessels, that means areas of the body that have low blood supply, lack of oxygen, I can actually repair them. I can send more nutrients and oxygen to those areas. Here's another peptide. Here's another peptide, also studied by Japan. It is the Valium tyrosine peptide. Okay, this is a dipeptide, and it has been found to have ACE inhibitory activity. And ACE inhibitors are one of the class of medication that we use to treat high blood pressure. Wow. So imagine if I can find this peptide, this natural peptide, instead of taking chemical medication for my blood pressure, I can have a natural peptide that can help me to control and lower my blood pressure. Oh, wouldn't that be great? And here's another peptide studied by Japan that is found, okay, comes from metals, yeah, found to reduce or prevent the amount of blood clots in the blood vessels, which means to say that unlike medications that we give like warfarin or dabigatran, this medication, this peptide prevents a blood clot only inside the blood vessels, which means to say that if you have an injury coming out, it will clot uncontrolled bleeding, unlike the medication that has been proven to lower the. So, all peptides. I recently had a heart attack. So, if you come to see me, okay, if I use Gregory here, if you had a heart attack and then you get admitted to the hospital and then you come to see me, do you know what I will have to do? Number one, I have to give you antiplatelets. I have to make sure that your blood does not clot again. This is called prevention. I have to give you blood pressure medication. I need to lower your blood pressure because high blood pressure will stress out the heart. And that is all I can do. I cannot do anything else. If your heart attack is because you have a blocked heart blood vessels, I can maybe offer you bypass to do a major operation, put in another blood vessel so I can bypass the top area so that your heart at least can still get some blood to function. But imagine this, if I can find the peptide to lower blood pressure, and I can find the peptide to prevent the blood clot formation, if I can find the peptide to grow new blood vessels, and at the same time find the peptide to get my cells to regenerate, wouldn't that be great, right? Now the thing is this, there is. So introducing SOP Subarashi, for me, this is the main product. This is the gold product under AFC, the best in my opinion. That actually contains all four of these peptides, all four of these patterns, the cell regeneration pattern, the new blood vessel growth pattern, the lowering blood pressure pattern, and also the prevention of blood clotting within the blood vessels pattern, all in one. Which means to say that I don't need to go around looking for salmon or going around looking for tomatoes and whatnot. I only need to buy and consume one product to get all these effects. Wow, isn't that great? So the thing also is that it is only 600 daltons, which means to say that it is smaller than proteins. So nano-sized peptide means that it is easily absorbed. Once you put it into your mouth, it will pass through easily your mucosal membranes in the mouth, your cheeks, your tongue, your under your tongue, all the membrane areas full of blood vessels. These peptides will immediately pass through, enter your bloodstream, and immediately start providing their effect once they enter the cells. So isn't this great, right? So more peptides. Here's something that people who are advancing in age, getting old, they are worried about, because the older you get, the weaker your immune system becomes. You are more prone to diseases. And if your body's security guards cannot monitor properly your body cells, there will be some opportunistic cells will turn into cancer cells. And then the reason why elderly people have so high risk of getting cancer. So here's a peptide that has been studied by the Japanese that relates to an anti-tumor agent. So they came out with this. Let me explain this test to you, okay? Because for us doctors, we must see proof. We must have the test. So what they did was this. They take mice or rats, typhus, and they inject breast cancer cells into this mice. So the breast cancer cells will start growing in the mice. Okay, it developed into a tumor. So for group A and group B, they gave them food with this peptide. For group C, no peptide. And after 40 weeks, they measure the size of the tumor growth. And guess what? For those who were given the peptides, the tumor growth was slow. For those without the peptide, the tumor growth very fast. So this peptide actually can stimulate anti-tumor cells in the body to fight against the tumor. Wow. This one will help us with prevention, right? Here's another one. Also studied by the Japanese, and this peptide actually helps increase our white blood cells. So when we look at the white blood cell count, for those who are given the peptide and those who are not given the peptide. So as they more 8 days, this is in days, after 8 days, you see that those without the peptide, the increase of the white blood cells is low. But those with the peptide, the increase of the white blood cells go much higher. So if you can stimulate and increase in activity and number of the white blood cells, that means you have more defense, you have more immunity. That means you can fight more diseases, okay? And it has been found also to help you fight against viruses. Like now, influenza virus, you can boost your white blood cells, you will probably be safer, right? And of course, this another peptide studied by the Japanese has found to be able to help protect the liver in people with hepatitis C. So we understand that people with a liver disease or liver infection, the liver enzymes will go up. So your AST, ALT, your LDH, everything will go up. But in patients who were given this consume, you see that down. So that means that I have something to boost my immunity, protect my liver, and also help me to fight against cancer. How to fight against cancer? So this is something from Dr. Sukri Siagan, which actually I use this slide because not because I study what he claims, but actually because he lists out already all the things that I want to say inside here. So basically, I mentioned just now, the only way to fight cancer properly is for your body security guard to check regularly every cell. Because any cell at any time can become cancerous. It can spoil. So we have this security guard called NK cell, natural killer cells. And these cells are the ones that go around touching every single cell. to know whether or not they are still healthy or they have turned to become cancer. If the natural killer cell detects a cell that has gone wrong, has a spoil already, this natural killer cell will kill that cell. So it does not have a chance to multiply and turn into a cancer or a tumor. Now the thing is this, if you are getting older, the number of security guard will reduce. Okay? And we have found that we have observed that patients who take this product regularly boost the natural killer cells. So just now, I mentioned that there are so many different patterns, right? For anti-cancer, anti-tumor, and also immune system boosting, legal protection. These are all the patterns available, proving that the contents in this product, Utsukushi AFC, will produce this effect if you consume the peptides that are contained in this product. So now the thing is this, when you take these peptides, it does not show you the effect. Boosting immunity does not give you a very obvious effect. So AFC company, very smart. They put in something that will give you an effect. So what did they put in? They put in salmon DNA. They included salmon DNA, which is very effective in improving the regeneration of skin. And most importantly, getting the skin to absorb collagen. You have to understand that if you consume only collagen and your skin is not healthy, it does not absorb the collagen. And if it does not absorb the collagen, there is no effect. There is no beauty. But if the skin is healthy, it is active, and you provide it with collagen, you will see a very great effect. So they included this salmon DNA into Utsukushi, and for people who consume Utsukushi, they are able to see a difference in the skin, a reduction of spots, pores, dry skin, and also some of the wrinkles. And if there is an effect on the skin, that means that all the effect of immune boosting and natural killer cell boosting is already there. Wow. So that is the great thing about Utsukushi. It also contains good bacteria, right? Probiotics that can actually help you with gut health, can help you improve your absorption. And finally, one more product I want to share with you all that is so good. This one. Okay, we say that Japan do all the study, maybe got some biasness. But this product is not studied by the Japanese. This product is studied by the United States as well as the European countries. So here is their pattern to show that this supplement can improve visual performance. And this supplement must contain lutein and zeaxanthin. This pattern shows that found a method for treating eye diseases like nearsightedness, farsightedness, astigmatism, and a result of lutein and zeaxanthin, it is able to show that there is an improvement in all these diseases. Another one, this is from Europe. They studied using lutein to improve memory. From the United States, they studied using lutein to enhance the brain activity. And this is the best one. From Europe, they found an extract that improves the rate of neurogenesis, which is nerve growing. So, see again, study when they mark some of the brain out, but if you read the description that they say down here, Basically, it says that in the first picture, they mark the brain cells, and then they treated with spearmint extract. And then when they look again at these brain cells, they found that these brain cells were dividing, they were multiplying. Only a few years ago, about 5 years ago, before COVID, if you ask any doctor, my family member got stroke, can recover or not? All the doctors will tell you, sorry, nerve cells, brain cells cannot grow again. So if they are damaged, that's it. We can try to rehabilitate you, but it's not going to be very effective. Today, I will tell you, they are all wrong. Spearmint extract peptide can stimulate neurogenesis. Means that contrary to the previous belief, your brain cells and your nerve cells can regenerate, can multiply, which means that you can recover from a stroke or from brain damage. Wow, that's so special. So, what product is this? Hikari from AFC. It contains all 5 of these patented peptides inside there to help you with your eye health, your memory, brain function, as well as help your brain to regenerate. It is also very small, 400 daltons, and contains a lot of antioxidants, specially formulated for anti-aging. Because we understand that the reason why we are all aging, having wrinkles, having stuck of this old man spots, having unhealthy skin, these are all because of oxidants. Every time we breathe, we live, we regenerate, we produce a lot of oxidants, and this damages further our tissues. If we put in antioxidants, we can reverse this damage, and we can reverse aging. This is what we call anti-aging. So, we talk about the product, so good, it has been proven, it's been studied. So, of course, let me share a little bit about the company that made it all happen. So, AFC, Asayama Family Club in Japan. And AFC, you may not have heard it, you may not have heard about it in Malaysia. That's because AFC, they not really come out as a promoting company or a sales company. They're actually a pharmaceutical company, which means that they are a company doing research. So they stay in the background, they study different peptides, different medication, different substances, and they find things that can actually help us benefit. Previously, was studying things to treat diseases, and now they have found peptides that can actually help us regenerate as well as recover. So, AFC started actually as Honzo Pharmaceutical studying herbal medicine in 1831. It's about 190 plus years ago. And they also opened stores in Japan itself. So actually, if you try to search for AFC, you don't really find their products. That's because they don't really sell products, but they do sell their peptides. They sell their peptides. And if you Google marine placenta, you will see a lot of Japanese companies, so OEM. Okay, and in 1983, they came out with this medical research institution. In 2004, they actually supplemented and went on Tenko TV as a health TV station to educate the public. All right. And in 2018, they appeared in Indonesia. This story for a long time. You only need to know that since 2018, the Indonesian people have been benefiting from these peptides and benefiting from better health and regeneration. And finally, 2024, it entered Malaysia. And now currently it is being marketed in Malaysia, Singapore, even in the US and the UK. So the thing is this, there are many doctor testimonials from Indonesia, of course, because, well, it's been in Indonesia for 7+ years. But I will tell you tonight, Malaysian also has doctors that have studied these peptides, has researched into it, has used it, and are now very happy to explain and promote it to improve the health and regeneration of their patients, of our patients. My right here first. Okay, and it's also been listed in MIMS, okay, which is a medical formulary or informative reference. And the thing about MIMS is this: you cannot simply put something in MIMS. It has to be something that has a proven effect and is proven safe to use before it can be approved to put in MIMS. And we see here SOP Subarashi for regeneration, Utsukushi Go for anti-cancer and immune boosting, and Hikari for eyes, brain, health, and regeneration. It's all listed in MIMS as a supplement and adjuvant therapy, which means to say that I, as a doctor, besides treating you and trying to control your disease, I can also advise you to take AFC products as an adjuvant therapy concurrently to recover. Finally, you can get well. You can get better. You can get healthy. So of course, it is safe. Okay, it has been tested. It is halal. So there's no worries of Malaysians consuming it. All right. And it's all organic. There are no preservatives, no artificial flavors and colorings. Okay. And they are all the certificate by Japan companies to prove that this product is safe. Okay. Of course, we have seen the studies. We have seen the theory. So this is one of our patients who consume this product, right? For the life of me, I cannot remember his name. He's one of our doctors. Okay, never mind. All you need to know is he has nasopharyngeal cancer. So when he had the cancer and he was undergoing chemo all the time, he was losing weight, he was unable to eat. And when you have cancer and you are undergoing chemotherapy, the immune system is so bad that he actually also grow fungus. Then he found AFC products. He started consuming it. According to him, he insisted to start consuming this even while he was in the ICU, while he was undergoing therapy. And then he took it, and you can see that the improvement is so good. Now he looks so young. He is fully recovered from cancer, and he is now one of the advocates for AFC products. Real life testimony. This is another which I like because you see that he is bald. 3 months later, you look at the amount of hair that is growing. So for those of you who have no hair, who have tried many different type of products and it does not show any effects, this is something you can consider because it does work. Okay, and of course, there are some testimonials because I deal with wounds as well. So there are some testimonials that can show skin repair, show wound healing, very quick wound healing. All right, and also regeneration while drying up. So this is actually very good. And for me, it's I'm looking not only into modern dressings, but now I'm looking to see whether or not I can actually help my patients recover faster by introducing them to peptide that can improve regeneration. Okay, and the thing is this, here are many examples, many pictures of people who consume Utsukushi with the secret ingredient salmon DNA, which actually help them to regenerate their skin. Okay, so now the thing is this: these are all examples. If you really want to see whether or not this will provide a real effect for you, I encourage you to actually get it, take your own pictures, consume it, and see the effects, see the benefits. A final testimony from my side. So the reason why I actually started looking into AFC products in peptide therapy, and the main reason why I purchased it was actually because my grandfather, 95 years old, diagnosed with stage 4 colon cancer. And at that point in time, in May, he was already having constipation, which means to say that the cancer was so big that it was blocking his intestine. So the only way to have remove stool, remove fecal matter from the blocked intestine is by opening the stoma, which means I have to do an operation, open up the intestine, and get the waste matter out from there. And that is actually very traumatic. And as he is 95 years old, it was not recommended. So I introduced him to Utsukushi, all right, and SOP Subarashi. And he started consuming it. And he passed away last month due to age. But this is my testimony. From the time he started consuming Utsukushi until the time he passed away, he did not have constipation. Wow. So that's the main thing that I want to focus on. It actually helped him to fight against the cancer, to shrink it enough that his intestine did not remain blocked. Of course, if you want to say recover, he did not have enough time left in his lifespan to recover, but he is able to live until his lifespan without having to do an operation to open the stone. So of course, when he started taking Utsukushi, he started bleeding because the cancer shrink and the cancer ruptured. So he started bleeding. And so he was passing out a lot of melena. So I told him to add on SOP Subarashi for regeneration. And guess what? After 1 month, the stool from blackish blood stool turned back into brownish soft stool. So this is the power of guts from my side. So here is something that can give your entire family health, energy, improving of your skin to look younger, to look more beautiful. And the main thing is it actually helps you regenerate from something that is unhealthy, something that is dying, to something that is living and vibrant again. So do you want it or not? If you do, please go ahead and get it. Contact the people who invited you to this talk. That will be the best way to get your hands on the peptides that can change your life. Recover or avoid chronic diseases. Okay, so that is for me because I focus mainly on the health aspect of this, which is the main reason why I do this. But I understand that when you do direct sales with AFC, if you have a good product, there is an earning potential. There is a way to actually make money from this. And I will stop here. I will hand the time over to Gregory, who will tell you how you can actually make money while benefiting from health improvement.
Thank you, Doc.
So, Gregory,
Yes, I'm here. Wait, let me share. Let me share mine. So guys, you can keep the question for later, even the medical one or the business one. We can answer the question at the end of this presentation. So in every product, I believe we have. Oh wait. Mm, okay. In every product, there is a business behind it, and can can everyone hear me?
Yes, can hear you.
Yes.
Okay. So I will bring the marketing plan for tonight. So in order to join us, you have to join with 3 packets. So sometimes we open with 1 boxes. We call it mini Ruby. So 1 boxes until 5 boxes, it's called Ruby. So either you buy 1, you buy 4, you buy 3, we call it Ruby. And then when you buy 6 to 11 boxes, you will be Sapphire. And then for the 12 box or the highest one is Diamond. So what happens if I buy the 13 boxes? We will suggest you to open a new account for it because there is no more higher than Diamond. There is no double Diamond or something like that. So we have like 3 bonus. The first one is daily bonus, the second one is monthly bonus, and then the third one is yearly bonus. We also have another bonus, trip bonus, and then we also have something like a king sponsor bonus, but that's one don't have like the exact days, how many days it will close. It depends on the board management to decide. For example, for this promo right now, we have like from September until March, so it's 6 months. It's trip bonus. So for the daily bonus, it's split into 3. For the first one is sponsor bonus, the second one is pass up bonus, and then the third one is team bonus. Okay, so I will explain the first one first. Direct sponsor bonus. What is direct sponsor bonus? So today, if you buy 2 boxes, you will be assigned as Ruby. And then, for example, tomorrow you bring one of your friend, which is your friend usually follow you. If you join AFC in Ruby, they will also join as a Ruby usually. So when he join also for Ruby, he buy 2 boxes. The next day, you will get 90 ringgit. Or in AFC apps, you will get 30 BP point. And then what about if Ruby sponsor the highest one, Diamond? You will get 540 ringgit. But if you really want to do business in EFC, I will suggest you to take the Diamond one. Because if a Diamond sponsor a Ruby, someone who buy 2 boxes, you will get 165 ringgit, which is almost double the Ruby sponsor. And then for the second one, this one actually is the, I will say, the passive income. When you have a bigger team, when your team is growing so big, then this bonus will give you the most bonus, I will say, daily. Because for example, like this one, Ruby, if you join as a Ruby, you can have 10 times team bonus. Or you can some team have presentation assign this team bonus as pairing bonus. So in AFC, you only have left team and right team. So we only have two legs. The first one at the left and then the second one at the right. So every team will calculate at 0, 0 at the end of the day. So for example, your left team have 4 boxes, sold 4 boxes today, and then your right team sold 4 boxes today also. Then you, on top of the direct sponsor bonus, you will get team bonus.
Okay.
I think it was
I
a way up there, the question. The first
yeah.
one will be Joseph.
Yeah. So yeah. So the question here, after consuming Subarashi, complaining of having severe pain from hip onwards, and pain will stop only if stop. Okay. Now the thing is this. This is very difficult to explain here without actually knowing the full story. So because AFC products is not treatment, you have to understand that AFC products is for regeneration and as a form of adjuvant therapy. So if there is some issue with the hip, maybe some issue with the bones, some issue with the muscles, if you take AFC product, especially Subarashi, which is helping your body to regenerate. And if this regeneration process will have an issue because of some underlying problem, then the underlying problem need to settle first. So you might want to look up visit your doctor and investigate what is the issue and the hip region, see whether there's any problems there that need to be fixed first before you try to do regeneration. You can actually try to liaise with Rosa or Grace. Maybe they can arrange for a consultation session with me, offline somewhere else, some other time, and then maybe I can help to look through, your daughter's problems and then better advice. Okay. So my volume, sorry, I'm actually outside. I'm in a shopping center. Because my wife is shopping, so I'm in the coffee shop. So I'm sorry that the volume and internet connection is not so good lah. Yeah, but I hope that at least the details in my slides and perhaps the best of the information has been conveyed. Hope. Okay, the next question here is please explain how SOP Subarashi helps with diabetes. Okay, so the thing is this. SOP Subarashi, as I mentioned just now, is for cell regeneration. When we talk about diabetes, we talk about type 1, which is no insulin because the pancreas is not working or the pancreas has died. And we talk about type 2, which is insulin resistance, where the cells don't want any more sugar. So they don't accept the instruction from insulin. So what SOP Subarashi does with regeneration is, in type 1 diabetes, it can help to stimulate the regeneration of the pancreas. So if you repair the pancreas, then the body starts producing insulin again, which means that you may not need so much insulin to be injected because you're producing some yourself. But you have to understand again that AFC products are as an adjuvant therapy. Please don't take SOP Subarashi to get well from diabetes and refuse all diabetic treatment that we have for you, because that is the fastest way to go to heaven. Okay? Please treat properly and then start your journey on regeneration so that you can start reducing the amount of medication that you need to take. And if you start very early in your disease, you have the chance to fully recover, fully regenerate, so you do not need medication at all. But never start with AFC product first. Treat first if you already have a chronic disease. In type 2 diabetes, the reason for the insulin resistance is because you are eating too much sugar and your body does not need so much sugar, so it develops a resistance. So the fastest way to reduce this resistance is by forcing your body to burn up sugar. So when your body burns up the sugar, your body will start wanting sugar and your body will reduce the resistance. Okay, of course, for the hardworking people, exercise, diet control. But the role of SOP Subarashi is cell regeneration. And we understand that cell regeneration, cell multiplication, uses a lot of energy. So while your body is trying to repair all the damaged cells and trying to regenerate, it is also using up a lot of sugar. And so insulin resistance can be reduced easily. But again, please make sure that you are treated properly before taking AFC products as an adjuvant. Okay. Yeah, Dr. Kwas. Okay, yes. I just couldn't remember his name. Um, okay, another question. How should we handle the rise in blood pressure and heartbeats in a stroke patient? So, first of all, if already have stroke, it is a medical disease. Please use medication, treat properly under medical care to control your blood pressure and heartbeat. Then you can add on as adjuvant therapy SOP Subarashi, which can reduce your blood pressure, reduce the incidence of blood clot formation, grow new blood vessels, okay, and provide cell regeneration to try and repair the damaged heart as well as blood vessels. Okay, so if it's for me, I would recommend high dose of SOP Subarashi. If you can afford it, 2 sachets in the morning, 2 sachets in the afternoon, 2 sachets in the evening. That will provide a lot of peptides to stimulate all this regeneration and protection. Of course, if you say stroke, so that means that there is also brain damage, there is nerve damage. You might want to consider adding on Hikari for the nerve regeneration to try and reconnect back the damaged areas of the brain. Hope that answers the question. One thing people may usually like to ask me is this. If we take too much blood pressure medication, we can cause damage. We can cause blood pressure to drop dangerously low. Does that happen with SOP Subarashi's blood pressure lowering peptide? The answer is no, because this is a peptide. This peptide provides an effect when there is a need, which means to say that this peptide, the valet tyrosine, it only performs its effect if the blood pressure is high. So if the blood pressure is normal, it is not broken down, it has no role to play, it does not provide an effect. So your blood pressure does not drop below the normal. It will not become dangerously low, not like blood pressure medication. So consume without worrying. Okay, next question. Loss of cervical lordosis. Any of AFC products can help. Okay. Cervical lordosis means loss of the lordosis means that your spongy bodies in between your spine has degenerated. So of course, if you take SOP Subarashi for cell regeneration, you can regenerate your spongy bodies. But you have to understand that when there is a loss of lordosis, it means that the spine has already started to collapse. And so if the space in between the spine bones is reduced, your spinal spongy bodies will not regenerate fully. So the main therapy for cervical lordosis is stretching. You need to put on a cervical collar or a neck brace or do stretching regularly. This is to lengthen your spine and to increase the space in between the spine bones. Then With AFC SOP Subarashi as an adjuvant therapy, you can stimulate the regeneration of the spine spongy bodies to grow back and provide the support so that you regain back your lordosis. I hope that answers your question. Arachnoiditis affecting the vulva equina or lumbar adhesive. Yes, siapin. Okay, so this is infection and heavy inflammation. So, SOP Subarashi will help for regeneration of the damaged areas of the spongy bodies, but only if you do proper physiotherapy and stretching. So for the inflammation, you can use the immunotherapy by Utsukushi. So Utsukushi peptides, they provide stimulate the improvement of your immune system as well as reduce inflammation. So this can actually help fight whatever infection there, reduce the inflammation, solve it, and then it can start to grow and regenerate again. Okay. Someone wanted to contact me personally. Yes. Thank you, Rosa. Contact the upline first or get in touch to get help to get in touch with Rosa. And then Rosa will try to link me to assist. Okay. Last question here. I see for dementia patient, any advice? Yes. So dementia, you have to understand that it is a disease of degeneration, meaning to say that there is no stopping it once it has started. So if someone tells you taking AFC can cure dementia, they are lying. It is not true. You have to accept that once degeneration starts, it does not stop. So what is the role of Hikari in this? Hikari will stimulate the neurons to regenerate. So any degeneration that occurs with enough peptide, you can stimulate sufficient regeneration to sustain the disease. Unfortunately, you cannot recover from degenerative diseases. So what you can do is reduce the degeneration for as long as possible until the patient reaches the end of the lifespan. So Hikari, and of course, not just Hikari, but SOP Subarashi to grow new blood vessels to support all the new neurons that are regenerating in the brain. So SOP Subarashi and Hikari together. I see one here, last one, because I need to, the shop's closing. Okay. Okay. Friend with lung cancer stage 3 taking Utsu plus SOP increment from 1 of each to 3 of each daily as advised. No improvement as lung tumor remains same size. 6 months, stop taking targeted drug reversal and tumor increase in size. Okay. So you see, this is a very good example of natural killer therapy. When you have cancer, the cancer cells are growing very rapidly. So the thing is this, as we saw in the study done by the Japanese, we see that the mice who were implanted with tumors, even though they were given these Utsukushi supplements, the peptide supplements, the cancer growth was, the graph was going upwards. So you have to understand that if the amount of peptides, if the amount of natural killer cells is not enough, they cannot successfully kill off all the cancer cells, but they can slow down the growth. So you see that in this case, I understand that Utsukushi 3 times a day. So 3 times a day is able to maintain the tumor size. That means that it is just sufficient to prevent the growth of the tumor. But if you really want to fight the tumor, you have to go up. You have to increase the amount of peptides. You can consider taking Utsukushi 6 times a day, or you can take it 2 sachets 3 times a day. Earlier I shared about my grandfather who was taking Utsukushi for his stage 4 colon cancer. I purposely did not tell you how much he was consuming because it's a very scary amount. But since there is this question here, I will share with you. He is taking 8 sachets of Utsukushi a day. He start at when he wake up at 8 o'clock in the morning, and he takes 1 sachet every hour. He will take at 8 o'clock, 9 o'clock, 10 o'clock, 11 o'clock, 12 afternoon, 1 p.m., 2 p.m., 3 p.m., 4 p.m., 5 p.m., 6 p.m. Then he stopped. And that was able to shrink his tumor enough that he was still able to pass motion. So you also see that this is an adjuvant therapy, you must have your treatment. If the treatment for the cancer is trigresses, please maintain that. If the treatment is chemotherapy or radiotherapy, please maintain that. Then only you add on your Utsukushi as an adjuvant therapy to support the killing of this cancer and tumor. So if you are trying to treat the cancer, I would advise, as what Dr. Gibby taught me 6 months ago, focus only on Utsukushi. Because SOP is for regeneration. You do not need regeneration here. Focus fully on Utsukushi. Try to kill as much of the cancer cells as you can. Once you see the cancer shrinking, then only you add on SOP Subarashi to regenerate the area that is left behind by the shrinking tumor. Okay, I hope that answers your question. Okay, I think I will answer Rachel's question before I leave. Myasthenia gravis. Myasthenia gravis is a disease of nerve. The nerve connection to the muscle spoil already. So when you have a spoiled connection because of a DNA issue, there is no recovery. I cannot, for the life of me, there is no such wonder drug available that can allow me to targeted change every single nerve, because that involves changing your DNA. It's the technology is not available in this world. So myasthenia gravis patients will develop muscle degeneration because the muscles are not being used. So we cannot repair the nerves, but we can support the muscle degeneration. So high doses of SOP Subarashi to provide cell regeneration. So it replaces the damaged muscle cells as they die from underuse. So you can maintain the muscle structure and the muscle strength for as long as you can. Again, you have to understand this is a degenerative disease. There is no recovery. It will only continue to degenerate. So imagine this. I just talked to one of my patients who had myasthenia gravis. This is his story. He was taking SOP Subarashi 6 sachets a day, 2 sachets 3 times a day for 6 months. And he says there was no improvement, no change. So for me, this means the degeneration has slowed down, and that it means there is an effect. Then he stopped taking for about 6 months. And then he noticed he degenerated very fast, and his speech became slurred. He had to walk with crutches. Then when he came to see me, actually he's not from my line. He was from another line. I don't know whose line, but he managed to contact me through a different channel under stem cells. And I gave him a consultation. And so the degeneration is there without the regeneration. you can continue to take cell regeneration SOP Subarashi just to maintain the status so it does not get worse. Okay, I hope that answers your question. I think the shopkeeper are chasing me out already, so I will
Yes,
say
Doc.
thank you all for your
Thank you so
attention
much. Thank you so much,
and
Doc,
good
for the
night.
time and for the explanation. It's very helpful, very informative.
Okay, so again, if any of you need more information and want to know more, would like to set up a consultation with me to discuss some medical issues, please get your uplines to try and connect with Coach Rosa or Grace Lu, and they will get in touch with me. If any one of you here are new, would like to purchase and try and see the effects of health regeneration, please do. If you would like